Today we want to talk about what is the difference between HRT and MHT. You're like, well, aren't they the same thing? I don't understand. So that's what we're going to discuss today. My name is Dr. Lori Marvis. I'm a board-certified family medicine, lifestyle medicine physician, and also working on menopause certification. So to really bring the expertise of medical care in the menopause space where women aren't speaking about it enough. So one of the topics I hear often is this discussion around HRT versus MHT. So I'd like to share that with you so you're having a little bit understanding. By the way, I just launched my free Master Menopause and Feel Fabulous webinar. You can see the link below. You'll learn the 3 top mistakes that women make during menopause and my 5-step blueprint, Master Menopause and Feel Fabulous, on how to really approach menopause and understand what your body's doing, what treatments, if any, are appropriate for you, and just really getting a good handle on what menopause is. So click it below. I hope to see you there. Okay, let me grab my notes real quick here. Okay, so first of all, remember, hormone therapy plays a really crucial role in managing a range of health conditions, right? So particularly for women during menopause, however, there's often confusion between those two terms. So menopausal hormone therapy, which is MHT, and hormone replacement therapy, which is HRT. So now again, while those terms are frequently used interchangeably, there's really some really interesting distinctions between them that not only reflect their specific applications, but also evolution in medical discourse. So let's go a little bit more. First of all, let's talk about the historical context. Where did HRT become from? So HRT is a term that has been used since, let's see, the early 20th century, and it was originally coined to describe the administration of hormones, primarily estrogen, to women who were experiencing symptoms associated with menopause. The goal was to replace the hormones that the body ceased to produce due to the cessation or the ending of the ovarian function, right? So the first uses of estrogen therapy were back in the 1940s and 1950s, and they were revolutionary, right, in relieving common menopausal symptoms like hot flashes, night sweats, vaginal dryness, mood swings. But over time, HRT expanded to include the combination of estrogen and progesterone, which is really important for women who still have a uterus, to protect against what we call endometrial hyperplasia and cancer. Again, these are risks associated with unopposed estrogen use. And then so for decades, HRT was considered a near miracle treatment, not only for symptom relief, but also for its potential to prevent osteoporosis and even cardiovascular disease. However, this enthusiasm took a hit with results of the Women's Health Initiative by WHI study in 2002, which highlighted potential risk associated with long-term hormone therapy. Really include the risk of breast cancer, heart disease, and stroke. However, we'll get to that in a minute. But so in the wake of the WHI study, the medical community took a step back, right, to reassess the use of hormones in menopausal women. Well, the risk highlighted in the WHI were significant. Subsequent reanalysis showed that risk depended on a variety of factors like age, time since menopause, and individual health profiles, and the type of estrogen and progesterone that were actually used. So very important to see those nuances. Now it became very clear that hormone therapy should not be a one-size-fits-all solution, right? In response to these findings, the term menopausal hormone therapy began to replace HRT in the scientific literature and in clinical discussions. So MHT focuses specifically on the targeted use of hormones to manage menopausal symptoms rather than the broader implications of hormone replacement in general health, okay? So remember, MHT underscores a more personalized approach, emphasizing that hormone therapy should be tailored to your individual needs, your risk, and the timing. So the change in terminology also helped clarify that hormone therapy should primarily be used for symptom relief during menopause rather than a preventive measure, which again comes along with more justification for long-term HRT use. So basically, the purpose, many times you think about HRT now is being utilized for women who've had premature ovarian insufficiency, meaning they, like, let's say they're 30 years old and their ovaries have stopped producing estrogen. These women actually need the HRT, the full hormone replacement, versus menopause, maybe you need smaller amounts. And again, there's some nuances to that. Of course, there are risks involved that we look at those considerations. This is, again, more approach in a more personalized approach. And then, of course, the therapeutic approach, right, where HRT, again, is used to prescribe to treat conditions that are unrelated to menopause versus MHT is just for menopausal women. So There are so many more things to learn about menopause, and I'd love to share with you. So if you haven't already, please click the link below, see my free webinar, Master Menopause and Feel Fabulous. And I'd be so tickled to have you there. And yes, thanks as always. I'm sending you gratitude, joy, love, and healing, because we all need more of that in this world. So take care.